Hello, my name is Kelly Schmidt. I am your instructor for D439, Foundations of Nursing. Today we will go over Chapter 17, Implementation. Implementation is the fourth phase of the nursing process. This process is when nurses initiate the interventions established during the planning phase. Implementation of the nursing process is significant because it involves action on the nurse's part to promote positive patient outcomes. If a care plan is not implemented, then there is a lack of nursing care, which will negatively impact patient outcomes. When the nursing care plan is implemented, nurses can begin to gauge patient responses to interventions. Implementation supports continuity of care. Care begins from the first patient encounter and continues until discharge. During the implementation phase, you're doing an ongoing assessment. The nursing care plan is developed based on data from the initial nursing assessment. However, because a patient's condition can rapidly change, or nurses may obtain new data, ongoing assessments are necessary to validate the need for proposed interventions. Ongoing observations and assessments provide information supporting adaptations of the nursing care plan to promote improved individualized care. We need to establish priorities. Utilizing data from initial and ongoing assessments, the nurse can then establish priorities for implementing care. Priorities are based upon which problems are considered most important by the nurse, the patient, the family, the significant others, previously scheduled tests and treatments, and available resources. However, before implementing nursing interventions, the nurse must review proposed interventions and determine the skills and knowledge level required to safely and effectively implement them. For example, the nurse will consider if a patient can independently perform an activity, if a patient member may assist, or if the activity requires assistance from a healthcare professional. Although some interventions require the skills and knowledge of a registered nurse, others are less complex and may be delegated to licensed practical or vocational nurses and/or assistive personnel. The nurse allocates personnel resources by determining the needs of the client, the type of personnel who are available, and the facility protocol for care. Nurses are legally obligated to document all interventions and any observations concerning the patient's response to those interventions. Documentation can be done on a checklist, a flow sheet, or in a narrative form. Any verbal communication between the patient and nurse or among other members of the healthcare team related to interventions and patient responses should be recorded as well. Like the other nursing process steps, the implementation phase requires broad clinical knowledge, critical thinking, and analysis skills, and strong judgment. Whether a nurse is caring for one patient or several patients, careful planning and time management skills are essential in this phase. Nurses must have psychomotor, interpersonal, and cognitive skills, as these serve as competencies through which high-quality nursing care is delivered. Psychomotor skills are necessary to safely perform nursing actions such as handling medical equipment competently. Interpersonal skills help nurses establish therapeutic nurse-patient relationships and promote interdisciplinary collaboration. And cognitive skills are necessary to help the nurse understand the rationale for proposed interventions and make appropriate observations. There can be some challenges in the implementation phase. The first one might be lack of clinical experience. Even when goals and desired outcomes are clearly defined, an inexperienced nurse may find implementing nursing interventions challenging. Inexperience may occur because the nurse is newly graduated or if a nurse is transferred to a department where they have never worked. How can we overcome this? Well, the most effective way to overcome a lack of clinical experience is to work as much as you can and gain experience. Patient care cannot wait for us to feel comfortable and performing unfamiliar tasks. So perhaps the best way to overcome is to speak up and ask for help. While we do want to work and work and work, we're not going to gain that knowledge as quickly as the patient needs it. As a nursing instructor, I always encourage my students to ask questions about everything. The only bad question is the one you do not ask. Nurse leaders, supervisors, and administrators appreciate nurses who readily admit when they need help or guidance. Another challenge can be patient noncompliance. Noncompliance is defined as the behavior of a patient or caregiver that does not correspond with the therapeutic plan that has been agreed upon by the individual, family or guardian, and healthcare provider. Noncompliance can negatively impact patient outcomes. It can reduce the patient's quality of life, and it can result in increased healthcare costs. One of the best ways to prevent or stop patient noncompliance is to involve the patient in all aspects of care planning. As nurses, we should ensure that the patient is educated about their illness, their plans to manage the illness, and expected outcomes of the therapies. Education should also include information on how noncompliance may negatively affect the patient's outcomes. The patient's understanding of all education should be verified, and if the nurse is unsure the patient clearly understands, the teaching should be repeated. There can be a challenge of a psychosocial factor. Psychosocial factors can impact all aspects of patient care. For example, if there is a presence of domestic abuse or violence, the patient may be afraid to discuss these important issues related to care, which could result in a misunderstanding of established goals. Psychosocial factors may seem a little tricky to navigate. However, if they become a factor affecting the implementation of the nursing process steps, nurses must find a way to try to address the issue. For example, if the nurse suspects a patient is afraid to discuss certain issues in the presence of others, the nurse should ask for privacy while talking to the patient. By doing so, the nurse offers the patient the opportunity to speak openly without fear or retaliation by the abuser. Then the nurse can discuss options for care with the patient on how to proceed moving forward. That concludes our presentation on Chapter 19, Implementation. If you have any questions, please reach out. Kelly.schmidt@wgu.edu. Thank you and have a great day.